Keeping the teen birth rate down. It's a goal Public Health Madison and Dane County is striving for by getting more contraception in the hands of teenage girls. The devices have been proven to be more effective than the pill. News 3's Danica Lewis looked into this. And Danica, what do these numbers reveal here?
Well, across Dane County, the numbers actually, Eric, have significantly gone down when we're talking about teen birth rates, specifically since 2009. Public Health Madison and Dane County wants to keep it that way and wants to do it by improving access to certain contraception. But some think that's sending the wrong message.
There's been a lot of support for increasing access to contraception.
Ask a teenager what this is or this, and chances are they know and possibly use them.
It just made us more aware.
The latest survey by Public Health Madison and Dane County shows 193 girls ages 15 to 19 gave birth in the county last year, up about 30 from 2013. But it's still almost half of what Public Health saw in 2009. Stephanie Kroll with the agency says so far the group's focus has been outreach to teen moms.
To continue to decrease rates, you really have to move towards prevention. You can't just keep providing the safety net services.
But in order to keep the birth rates down, Kroll says it's time to be proactive, providing methods like IUDs and implants or long-acting reversible contraception to Dane County teens.
It's very effective and doesn't require you to remember to use a pill, so especially great for teens.
If we're making these kinds of contraceptive drugs and devices available to teenagers, we're saying to them, this is the kind of behavior we expect of you.
Julaine Appling with Wisconsin Family Action says this plan is a dangerous push and something parents don't have to know about under federal law. While it may decrease birth numbers, Appling says it does nothing about STDs and says abstinence education can be relevant to today's teens.
I think it has at least the potential for short-circuiting their future.
But Kroll credits contraception for cutting down teen birth rate numbers so far and thinks it will only continue to do that.
Really want to keep continuing the downward trend in teen birth rates.
Now, there's nothing in the data to say why exactly, but something interesting to note, 98% of Dane County teen births were here in Madison. With concerns about parental involvement and compliance, part of the public health plan is to involve parents in a coalition that tackles these tough issues. And we should mention, according to the CDC, Eric, IUDs and implants are more than 9 times more effective than the pill when it comes to preventing unwanted pregnancies.
Always a subject with a lot of different opinions.
Oh, yeah.
Danica, thank you very much.
Sure.